Hey everyone, Dr. Alex Ritza here, downtown Toronto chiropractor, acupuncture provider, and manual therapist, aiming to be the best part of your day. So what we're going to talk about today, guys, is hip mobility. More importantly, what we're going to talk about is maintaining good hip mobility. Whether it's in my chiropractic practice or in the gym setting, I see a lot of patients that are focused on getting better range of motion through the hips, whether it's to manage their low back pain, improve their squat, or just generally feel a bit looser. And so improving the range of motion at the hips is relatively easy. The problem is maintaining it. So I find that with a lot of patients, after I do some adjustments or mobilization work, or they do some stretching and some self-mobilization, is those range of motion improvements that we get aren't maintained. And the problem with that is the nervous system. So let's say that we get a range of motion in a joint to improve from here to here, whether it's the hip or the wrist. If the nervous system and the muscles and the joint aren't used to working inside of that new range of motion and controlling all of the activities in that new range of motion, it will kind of revert back to where it's used to working. So an important thing after doing a mobilization or doing some stretching is doing a little bit of nervous system activation to let the muscles and the nervous system know that we have this new range of motion, that we need to control the joint in that range of motion, and that we're going to use that new range of motion in our daily activities. So we need to train strength through those ranges of motion. So what we're going to do is we're going to do a little bit of hip work, activating the nervous system when we've done some hip mobility work so that we can maintain those new ranges of motion and improve how our hips move. Okay guys, so we've done our mobility work, we've got our hip range of motion. We were initially here on internal rotation, and now we're out here. And what we're going to do is we're going to train the nervous system out here. So we take our resistance band, we apply a little bit of pressure, and we're going to do about 10-second pushes where I'm pushing this way and trying to rotate even more through the hip, holding it for about 10 seconds and relaxing. And we take about a 10-second break, and then we push outwards again, working on activating the muscles in that new range of motion so that the nervous system is used to working out here, so that it maintains those gains that we've gotten. We want to push with about 30 to 40% of what we got, so it's not an all-out push against the resistance band. You can try angling the resistance band in different angles to get a different level of activation in the different muscles. And for the opposite, we're working on our external range of motion. Hold the resistance band out here, pull the leg inwards. You're going to feel some work in the adductors as well as those internal or external rotators deep in the hip. And then relax after a 10-second hold. And then push again. There you have it, guys. Those are the exercises that you want to do after you work on your hip mobility to reprogram that nervous system and get the muscles firing in that new range of motion so that all the hard work that you put into improving your hip mobility doesn't go to waste. Check out more on my website at dralexritza.com or on the YouTube channel and follow along.